Good morning everyone, my name is Vania Sabrina and today I will be presenting on the music preferences for pain management across 20 countries in healthcare investigations, cause people may feel the different sensation after or while listening to music. So in healthcare, music also has a role. Music's role in pain management, highlighting its therapeutic benefits. Classical music is universally effective. Recent research shows self-chosen music works better. Cultural and demographic factors influence preferences. The study highlights the influence of cultural and demographic factors such as socioeconomic status, gender, age, and ethnicity. And the music preferences, like personal background, plays a key role in shaping music choices. In this presentation, I will discuss three key areas: the effectiveness of favorite music in relieving pain, the influence of personal background in music to relieve pain, and the hospital trick to manage patients' pain with the personal music. So, before diving into the findings, let's outline the key research questions that guide this study. The first is, how does a person's favorite music help with pain relief? And the second is, how do culture and personal background affect music choices for pain relief? And the third is, how can hospitals use personal music choices to help patients manage pain? These questions help shape the research approach and analysis. So for the methodology, the IFP's Music Consumer Study 2023 was a large-scale cross-sectional survey conducted in 26 countries, involving 43,500 respondents. It focused on global music habits, including the role of music in healthcare for pain management. The music as medicine question was asked in 20 selected countries. So, they use methodological approaches used in the IFP's Music Consumer Study 2023. The study used a large-scale international survey across 20 countries, collecting data from diverse populations. It analyzed music preferences for pain relief, considering factors like culture, gender, age, and socioeconomic backgrounds. Statistical methods, including logistic regression models, were used to examine trends and data. And data were weighed to ensure fair representation across countries. So, in research instruments, we have first survey questionnaire, second is statistical software, and the third is statistical models. For the survey questionnaire, used to collect data on participant music preferences, demographic details like age, gender, ethnicity, income, and choices related to music in healthcare. For the statistical software, data analysis and visualization were performed using Stata, RStudio, and R with statistical packages. And the third is statistical models. So, logistic multi-level regression models used to examine how gender and age influence music preferences for pain relief across 20 countries. And the next is logistic regression models applied in the UK and USA to analyze how income and race ethnicity affect music choices. And the last is Mozart effect analysis, investigated like the likelihood of choosing classical music over other genres in the non-favorite music category using a logistic multi-level models. The study ensured fair representation by weighting country samples equally and adjusting for variables like age and gender. Now, let's discuss the key findings from this study. Our research highlights four major insights regarding to the music preferences for pain management across 20 countries investigation in healthcare. So, the first is about percentage of music preference. Next is about percentage of favorite music versus non-favorite music. Fourth is about Mozart effect, and last but not least is about percentage no music at all or no music preference. Okay, so let me explain it. The study found that a significant majority, around 86.5% of people prefer listening to music when experiencing pain in healthcare settings. Most participants, around 73.1%, choose their favorite music, while the 26.9% opted for non-favorite genres. Interestingly, 43.3% of those selecting non-favorite music preferred classical music, reinforcing the idea of the Mozart effect across cultures. However, a minority, 13.5%, reinforcing the idea of Mozart effect across cultures. So, the result also highlight cultural variation in music preferences for pain relief, suggesting that personal and societal influence shape this decision. And for the discussion, this study shows that music helps with pain, and most people prefer their favorite genres over universal options like classical music. Personalized and culturally sensitive approaches are needed in healthcare. However, there are challenges such as lack of clear guidelines and the difficulty of meeting diverse preferences. Without proper protocols, integrating music therapy is challenging. To address this, hospitals should create personalized music programs, use preference surveys, and train healthcare staff. More research and collaboration are needed to improve these strategies. So, in conclusion, this study highlights that most people are open to using music for pain management, with personal music preference playing a key role. This finding emphasizes the importance of patient-centered and culturally sensitive approach in healthcare. However, there are limitations to consider. The study doesn't account for all possible factors influencing music choices, and the result may not apply equally across all healthcare settings. More research is needed to refine our understanding of how different groups respond to music in pain management. To move forward, healthcare providers should incorporate music preference assessments into patient care, develop structured music therapy programs, and educate medical professionals on its benefit. Further studies and collaboration are necessary to enhance the integration of music into healthcare. Thank you so much for paying attention to my presentation. May the information can help you to get some knowledge. Bye!